Welcome back everybody, welcome to my channel, and today we'll be discussing all about the complications of diabetes mellitus. Today you'll come to understand why diabetes is such a hell of a problem, right? Why are the complications too important to learn? So there are two basic types of complications in diabetes mellitus. One is acute and the other is chronic. As the name sounds, acute is the sudden medical emergencies of diabetes mellitus that need to be managed right away. And the chronic are the ones which are going to be late in their onset, but ultimately there are also going to be complications. So let's start the video with acute complications of diabetes mellitus. These complications develop rapidly and they require immediate medical attention. So there are three types of acute diabetes mellitus complications: hypoglycemia, diabetic ketoacidosis, and hyperosmolar hyperglycemic state. So hypoglycemia is a drop in your blood sugar level, or you can say low blood sugar levels. These are usually caused either when you forget to take your food, either you forget to take insulin, either you take insufficient food, or you do excess physical activity. And diabetic ketoacidosis is a medical emergency in which there is too much ketone body production in the body because there is an absolute lack of insulin, and so body is going to use fatty acid instead of sugars to provide energy to the cells. And in this condition it can lead to a dangerous acidic environment in the blood which needs to be managed immediately. Let's come to hyperosmolar hyperglycemic state, HHS. It is a severe condition characterized by extremely high blood sugar levels leading to dehydration and potentially life-threatening complications. These acute complications can develop quickly, sometimes within hours or days, and often require immediate medical intervention to prevent serious consequences, even death in some cases. Now let's come to chronic. There are various types of chronic conditions also, such as damage to blood vessels, which is a microvascular complication. In it, retinopathy and nephropathy are the ones we study. Retinopathy is a high blood sugar level which damages the blood vessels in the retina. The retina is the light sensitive tissue at the back of your eye. If retinopathy occurs, it can ultimately lead to loss of vision, even permanent blindness in some cases. Nephropathy. Hyperglycemia damages the kidneys, filtering units which are nephrons, over time, leading to diabetic nephropathy. This condition can progress to kidney failure and necessitate dialysis or kidney transplantation. Okay, next we come to neuropathy, nerve damage. It can be autonomic neuropathy or peripheral neuropathy. Let's study about peripheral neuropathy. It is when the elevated blood glucose levels damage nerves, particularly in the legs or arms or feet. This can lead to numbness, tingling, pain, loss of sensation. Peripheral neuropathy increases the risk of serious sores and injuries because there will be loss of sensation. You won't know about any sores and it can bleed and get infected, and ultimately you may have to get amputations done because of infections and gangrenes. Autonomic neuropathy. Hyperglycemia can affect nerves that control involuntary responses, such as digestion, heart rate, bladder control, sexual dysfunctions. It can also lead to heart rate variability. Mostly people who get autonomic neuropathy, they have problem with the bladder. Cardiovascular complications. It contains complications such as atherosclerosis. High blood sugar contributes to formation of fatty deposits or plaques on the wall of your arteries, blood vessels basically, which narrows them down and hardens them, which ultimately leads to increased risk of cardiovascular episodes such as heart attacks, strokes, peripheral artery diseases, etc. The next one is impaired immune function. Increased infection risk. Hyperglycemia impairs the function of white blood cells which defend the body against infections. That is why diabetic patients are so immunocompromised that they get fungal infections, bacterial infections, viral infections. This can lead to usual infections of skin, urinary tract and mucous membranes. Okay, delayed wound healing. Because there is poor circulation and nerve damage, it ultimately leads to delayed wound healing. The healing process slows down and there are risk of infections. That is why we discussed amputations of the organs which get infected because of neuropathy, right? Because there will be formation of wound, but your body will not sense it because of lack of sensation in the leg. It will ultimately get infected, and there will be low response of your immune system. That is why inflammation will take a lot time to happen, and then there will be presence of infection. Ultimately, it will lead to amputation of that organ. So in this video, that's all. We'll come back in another video to understand about diabetes and oral health. We'll discuss it in detailed manner.